crosswords, please hand it over to Bhavani.
Now crossword time out.
The time is up. Thank you. Before we dive into the activity, let me ask you all, when was the last time you read a nutrition label and what was that you looked for?
Calories.
That's good. Calories. Anyone else? Fats, proteins. Yeah, that's good. Anything else you were looking for?
Fiber.
That's awesome, fiber. So before we dive in, let's see how we can level up our label reading today. Okay, 4 major things we all look for. First one, serving size. I know most of them might have missed this, but most packaged foods have very little serving size and we often consume excess. So this is the first thing we should be looking at. And next thing is calories. Yeah, we all do that already. And here's a trick. For the third one is opt always for nutrition dense foods. Instead of choosing just looking at just proteins, calories and carbs,
sure,
let's choose more vitamins, nutrients and most importantly dietary fiber. Okay. And next thing is 520 rule. That is the percentage of daily value. For this, let's do a quick activity. Let's treat it as a traffic signal. Okay, the green light is for good stuff. That is the dietary fiber and the vitamins, nutrients, vitamin C, iron, all these things. And the red light is for saturated fats, trans fats, cholesterol, and most importantly, sodium. So these the green light should be more than 20% EV on the label, and red light should be less than 5% EV on the label. So we will be having a few labels. Before we go to the labels, I have one more rule of thumb for you. Remember to always look for the first 3 ingredients because they make up the major portion of the product. So if the first 3 ingredients are whole foods like grains, fruits, and nuts, all these things, then it is healthy for you. And if the first 3 ingredients are refined products like maida or palm oil or refined sugar, then run as far as you can. So the longer the ingredient list, the unhealthier it is. So let's always look at 3 S's. Remember to look for 3 S's. Can anyone guess what are the 3 S's we are looking for?
Fats.
Okay, saturated fats. Anything else? The other 2? Anyone?
Sodium.
Awesome. And one more.
Sugar.
Very nice. That's the sodium, saturated fats and the sugars. So saturated fats, according to AHA, it should be less than 5 to 6% of your daily calorie intake. For a 2000 calorie diet, it is about 11 to 13 grams per day. And for sodium, it's not just salt we are looking at, but it hides in many other products like MSG and many preservatives like sodium benzoate, disodium phosphate, ascorbate, etc. And the daily limit is for a healthy adult is just 2300 mg, which in salt is just 5 grams, that is 1 teaspoon. So for an individual, a salt intake per day should be just 1 teaspoon. So if you are a family of 3 or 4, you can just add it up to 3 or 4 teaspoons, and that is all you can have. And when you are having processed food, we'll see how bad it goes. Let's see, when we go to a supermarket, the first thing we look at is the front of the packaging. And most of these packages are misleading. It says 0% fat, no sugar, and heart healthy oils mainly, and enriched with vitamin A, D, E, and all these things. But how good are these for you? So for this, we need to turn the product and look at the nutrition label. First, let's go to the first meal of the day. So how many of you have cereal as the first meal of your day?
Sometimes.
Raise your hands if you.
That's very few. So I'm assuming that most of you here are having whole foods as your cereal. That's wonderful to have such a good healthy audience. So let's crack the code of a regular cereal which most people consume. So who's gonna tell me the first 3 ingredients in this which are not so healthy? Anyone?
Sugar. Palm oil.
I'm leaving one mic here.
Palm oil.
If anyone wants to use it. And you can be louder. It's a small hall, so we don't need really the mic.
Who's answering this?
Total sugars.
That's nice. Total sugars. Anything else?
Yeah, somebody said
Saturated fats, yeah. Palm oil, yeah. And also, what the product promises is a long-lasting energy, but is it really delivering that? It's just a sugar rush which is lasting only for a few hours of the morning. That is gonna end before you have your first coffee. And also it says whole food, which is only 48% of the whole wheat which is in the product, and rest of that is processed food. Okay. And also one more thing to always look at this is we only have a serving size of 30 grams, and 30 grams is giving you almost 6.6 grams of sugar. We're not even there yet to add milk. It's gonna add more, and some people even add an extra spoon of sugar, unknown of the fact that it already has a lot of sugar. That will be equal to 4 to 5 teaspoons of sugar a day, which is beyond the limit you're consuming in a breakfast. Next product. Often it is perceived as a light snack, and how many of you can guess how many chips will be there in a pack of chips? A single serving pack of chips.
10 chips.
Yes, 10. That's right. So it will be around 10 to 12 chips. So who stops at 10 chips here? You can raise your hands. Yeah, no one stops at 10 chips because it is pretty addictive. What is it leading to the addiction here?
Anyone would like to answer?
What is making it so addictive?
Tasting salt.
That's right.
Tasting salt.
Yeah, that is there, and the main important thing is the salt. The sodium levels in the food are making it so addictive that we are craving for more and more. And also the serving size is so less. It's only 10 chips, and we want to have more. We obviously consume more of it, and it's giving you more calories, more saturated fats, and more salt. There is a hidden ingredient in this which is even more worse. Who can guess what it is?
Any guesses?
No. There's a very bad hidden ingredient. Remember the 3 S's we studied? We talked about salt and saturated fats. Sugars. Who guesses that there is sugar in a savory snack? So all these snacks usually have a hidden sugar content in this, which you will only notice when you turn the package and read at the ingredients. Next thing. Very commonly we take this with the chips because it tastes good. So a packed juiced carton. So how much do you think is the serving size of this? It's almost 180 ml, but how much is the fruit you're getting from this?
Any guesses?
1 or 2%.
0.
Yes.
Someone is saying 1 or 2%.
Yes.
0.
Yes. All of you are correct because there is absolutely zero to very little fruit in this, and that is also is from the concentrate which is made. And how much fiber? Anyone can read the label and show me how much fiber it is there in this carton?
Zero.
Everyone saying 0.
Yes, that's right. There is no dietary fiber mentioned itself on the package because there is none. But a single fruit of orange, if you are taking, it is giving you almost 3 grams of fiber. So where is the fiber going when it is 100% juice? Just vanishes into thin air. So yeah, most of the juice we get outside is 100%, not 100% fruit. It is mostly from the concentrate and very high level of added sugars. So the total sugars we are getting from this is not even just 100 ml is giving you 12 grams of sugar. That's almost 2 teaspoons of sugar. So do you really want to have 2 teaspoons of sugar in your juice? Will you do it when you are doing it at home?
Not really.
Yeah. So it's better to go for whole fruit if you are looking for dietary fiber and a healthy option. Next. So we often see this as perceived as a healthy snack because the name itself says it's digestive biscuits. Is it really gonna help with digestion? How many of you say yes? How many of you say no, it doesn't help in digestion? You can raise your hands. Some are saying both yes and no, I guess. Okay, so what's wrong with this label?
ऑन है, इसमें लाइव भी चाहिए स्क्रीन पे?
नहीं, लाइव नहीं चाहिए, लेकिन यहाँ से वीडियो रिकॉर्ड होना चाहिए पूरा. हाँ.
So, who can tell me in particular what is specifically wrong with this, the so-claimed digestive biscuits? Digestion. How many of you say yes? How many of you say no, it doesn't help in digestion? You can raise your hands. Some are saying both yes and no, I guess. Okay, so what's wrong with this label? Any guesses?
Everything.
That's right, everything. So, who can tell me in particular what is specifically wrong with this, the so-claimed digestive biscuits?
Palm oil.
That's right, palm oil and that's right. We are hitting the right point, that is hidden sugars. So we have seen products which directly giving off sugar, but these hidden sugars are even worse because we can't even, most people can't even understand that they are sugars. A normal layman can't understand that liquid glucose and dextrins and maltodextrin, all these are, no one knows that these are sugars itself. So unknowingly you are consuming more and more sugars, and the best trick to know how much sugar you are reading is from the nutrition information, that is giving you a total added sugars itself as 11.9 grams. And so-called digestive is giving you any bad health, or it's not unhealthy to you, but there are a lot of numbers. Sweetness 955, 950. It's more like holding on to a chemical. So there are a lot of added sugars, artificial sweeteners, and many other types of sugars which we might be not knowing. Let's look into that deeper. Sugar and its alternatives. So we all know that natural sugars, fructose, is present in most of the fruits, and if you want to go for, if you have a sweet tooth and want to consume a sugar, it's always preferred to go for a whole food option like dates or any fruit. That's the best sugar you're gonna have. But also remember, when you're purchasing a product, even though it says no added sugar, it might be still having natural sugar products in it. So it's good to look at the back of the pack to know how much sugar you're consuming. And added sugars. If you see high fructose corn syrup, just leave the package there and go home. And next thing is artificial sweetness. So no sugar products have this. So it's if it is unavoidable that you still want to have a little bit of no sugar product, then go for something which has natural sweeteners like stevia, monk fruit extract, erythritol, or coconut sugar. And there are artificial sweetener options as well, but not as healthy as it might seem. These are aspartate, saccharin, etc. But there is much more additives and preservatives which we may not be unaware of in these product packaged foods. So if you look at a ketchup bottle, in front it might seem like a hole. So you want your plate to look more colorful and vibrant with whole foods and not packed with numbers and chemicals on it. So what are some alternatives you can have instead of this package? The way that smart eating starts with smart reading. Look beyond the marketing claims and choose your products wisely. Here, thank you for participating, everyone. Enjoy the rest of the conference.
Good morning, everyone, and a very warm welcome to all of you present here. Andra. I'm an anesthetist and a lifestyle medicine consultant, and I'm an ambassador for Pan India, and I'm also the chairperson for the Hyderabad City chapter of Pan India. It is a great pleasure and honor to welcome you all here on this special CME on evidence-based nutrition, and a very warm welcome and special welcome to Dr. Rajina Shaheen, who is the medical director of Pan India, and she's flown all the way from Bangalore, and all the distinguished guests and diseases. And we are very fortunate to have a very diverse group of doctors today, very accomplished doctors who will be the speakers and panelists for our session today. PAN, you probably all know about PAN. It stands for Physicians Association for Nutrition, and it is a global NGO with a mission to eliminate the and passionate people with me, and whoever is, I urge most of you here, whoever wants to carry this forward, help us in this mission, can join PAN with us. This CME is not only to create awareness, but this is also a space for us to learn from each other's experiences, and the enriching and a very good experience for all of you present here. Thank you. I would like to invite all the PAN ambassadors, Dr. Rajina Shaheen, and all the PAN ambassadors to come on the dais. We're just watering a plant.
Tradition of watering a plant, since we're taking the movement forward towards the mission of enabling better health for both the people and the planet. So every CME we have this tradition of watering a plant and starting all the sessions.
So we have our first presentation now. Many of you must be aware about Dr. Rajendra Ramagiri. So Dr. Rajendra Ramagiri did his MBBS from SV Medical College, Tirupati, Masters in Emergency Medicine from Care Hospital, Banjara Hills, Hyderabad, Fellowship in Critical Care, Certification in Plant-Based Nutrition from E. Cornell University, USA, member of ISLM, Indian Society of Lifestyle Medicine, which is affiliated with the American College of Lifestyle Medicine. He is passionate about educating people to lead healthy lifestyle through his videos, ebooks, webinar, and speaking at events. He is quite popular on the social media. Hundreds of people in reversing lifestyle diseases like diabetes for past 3-4 years, and educated more than 50,000 people through his webinars. So let's have a round of applause for Dr. Rajendra Ramagiri. Sir, please.
Good morning, Hyderabad. Okay. So I really appreciate each and every one of you, because Sunday is the day where we get time to spend with the family. So in spite of that, you are here. So big round of applause for yourself. Yeah. So thanks for the warm intro. So I'm Dr. Rajendra. So basically, I'm emergency and critical care physician turned into practicing lifestyle medicine. I have my clinic at road number 1 Banjara Hills, opposite to Viranchi. So let's get into the topic. So previously, if we used to see the diabetic patients beyond around 50, 60 years, right? Now, a lot of doctors we are seeing at the age of 25, 30, 35, a lot of youngsters getting into diabetes. Why is that happening? Lifestyle. So, yeah, genetic predisposition and lifestyle, and a lot of junk foods, processed foods, and packaged foods, and lack of physical activity, late night sleep, stress. All these factors are contributing for the lifestyle issues that we are facing, whether it is diabetes or hypertension, obesity, cholesterol. All these issues are because of our improper lifestyle. So this is a recent article by Lancet where it is showing there is a rapid increase in the 100% of patients will go through the same journey. So what is meant by reversal? Let us understand what is meant by reversal. So in the traditional way of treatment, what is happening? With the time, the sugars are coming out, sugars are increasing first thing, the medicine dose is increasing, and the complications are happening in the longer run. In the reversal, what we are doing? We are able to control the sugars and reduce the HbA1c and reduce the dose of medication or even stop the medication. So why the complications are happening in the diabetes? Because of uncontrolled sugars, one. And even though if you are controlling the sugars, if you are controlling with more medication, it's of no use, right? Because of that, we are facing the complications. What we are doing in the reversal, we are able to reduce the dose of medications and controlling the sugars. And scientifically, if you can say, if you are able to maintain the HbA1c below 6.5 for a period of 6 months without any medication, that is considered as reversal or remission. There is a lot of controversy regarding the reversal and remission. If I use reversal, you can consider it as reversal or remission, anything. Right. So this will be the typical journey of diabetic patients. What we are doing in the reversal, we are reducing the dose of medication and eventually stopping it. Right. So why people depend on medications for lifetime? So let us understand the science. So let us understand with simple infection. If somebody have infection, what is the root cause for the infection? There is a bacterial or a viral infection. What we do, generally we give paracetamol to treat the fever. If they are having the fever, we give the paracetamol to reduce the fever. But if we are not addressing the infection, so the fever will persist, right? So we are just treating the symptoms of fever with the paracetamol, but we are not focusing on the infection, so they will consistently have the fever. So when we are addressing the root cause, which is infection, the fever will permanently go away. So in the same way, the root cause for diabetes or increased sugars is our improper lifestyle. Without addressing the lifestyle, however, whatever the dose of medications that we are giving, that will not help. So what we are doing in the reversal is we are focusing upon the lifestyle, which is the root cause, so that we are able to reduce the insulin resistance, we are able to control the sugars, reduce the dependency on medications. Right. So who is fit for reversal or remission? The lesser the age, the better the results. If somebody is having less than 30, 40, 50 years, that's a good fit. Even less than 60. If somebody is 70, 80, it will be tough to achieve the reversal or remission. And The duration of diabetes, the lesser the duration of diabetes, the better the results is. I mean, less than 6 months, 1 year, 2 years, less than 10 years are good fit. If somebody is at 20, 25 years, they are not good fit for the reversal. If somebody is obese, they are good fit for reversal. When they lose the weight, especially body fat, that will have very good impact. So, why should we focus on reversal? Because as we know, a lot of complications will happen with the diabetes, increased risk of stroke, cardiovascular issues. There is 2 to 4 times increased risk of cardiovascular issues, and diabetes is a root cause for the blindness and nephropathy issues and the neuropathy. All the complications will happen. That's why we need to focus upon the reversal as a mission. So, so there will be decreased lifespan of 12 years for the diabetic patients with the previous CV diseases, and 2 to 5 times increased risk of cataract in the diabetic patients. And there is 16 years of reduction of lifespan with the diabetes because of the CKDs and dental infections and all. So because of all these infections, because of all these complications, diabetic patient is spending nearly 15-20 times as per the Times of India survey because of the complications, stenting, CKDs, amputations and all. So apart from that, there is a recent Lancet study. So if somebody is getting the diabetes in 30 years, that is reducing the lifespan by 14 years. And if somebody is getting in 40s, that is reducing the lifespan by 10 years. That's why we should focus on reversal and remission rather than just managing with the medication. This is the importance, right? And most important thing, once we are able to reduce the HbA1c, 1% reduction in the HbA1c is reducing the risk of stroke by 12%, 19% cataract reduction, 16% heart failure reduction, and 14% reduction of myocardial infarction. All these complications we are able to reduce just by decreasing the 1% HbA1c. When we are in the reversal, we are able to reduce the HbA1c to below 6.5, where we are able to reduce the risk of all the complications by at least 80-90%. That is the importance of working upon reversal as a mission. Right. There is a case study that I want to share. This is a young guy of 32 years. As we discussed earlier, we are seeing a lot of youngsters who are getting into the issues, right? This is a young guy, unmarried, 32 years, with a overweight and obese. When he came, he was having a lot of complications like pain in the legs, overweight, frequent urinations, and the tiredness, fatigue, lack of proper sleep, late night sleeps. All these are the symptoms when he came to us in the month of May with a 12.8 HbA1c with a 105 weight. Right? So we have made dietary changes. Apart from that, a lot of lifestyle changes we have done. We have included a lot of balanced diets, complex carbohydrates, healthy fats, and the fiber into the diet. Right? So dietary interventions. What are the dietary interventions we have done? So in the diet we have included 50% as non-starchy vegetables, 25% healthy proteins, and 25% to 30% as the carbohydrates. These are the different macronutrients we have included. And we have, as he needs to lose the weight, we have included ashgad, which is low glycemic index and the high fiber. And the carbohydrate intake we have restricted to around 40%. And in the morning, we have included ashgad. In the evening, green smoothie with the low GI fruits and anti-diabetic herbs. And these are the food plates the patient shares with us regularly. We monitor the case on regular basis, like Pesura 2 and Beshan Chila, millet chidli, or the dosha. All these things we have included in the diet. So this is like a balanced diet where the carbs are restricted to 30-40% and the protein in the form of dal and the lentils and salad. This is how we have planned the diet, planned the food plates. So these are the different food plates, right? So carbohydrates, we have switched from the simple carbs to complex carbs. Like we have cut down on all these are simple carbs and the white bread, soft drinks, cakes, and all the stuff we have cut down. And we have included a lot of complex carbs. And proteins in the form of lentils, dals, legumes. We have included nuts and seeds. All these things we have included in the journey. And fats, healthy fats, we have included nuts, seeds, cold-pressed oils, refined oils. We have switched to the cold-pressed oils. And all these changes we have done. We have included majorly fibers, 4 to 5 servings of fibers in the form of fruits, salads, nuts, seeds, cucumber, carrots, bell peppers, all these things we have included in the diet. Every meal we have included a bowl of salad in lunch and dinner. And evening is a major culprit for the patients. So in the evening, a lot of people tend to eat the unhealthy stuff, samosa, bhaji, puri, bunda, all the nonsense we eat in the evening. So we have included healthy snacks either in the form of fruits or the mixed nuts, apple with the peanut butter, or sprout shots, chia seed pudding, other green smoothies. Different options we are given in the evening to prevent eating junk foods. And we have replaced with the milk-based teas with the herbal teas like the ginger tea, hibiscus, green tea, and the peppermint and the cinnamon teas rather than the milk-based teas. Milk contains insulin-like growth factor which worsens the insulin resistance, so we have replaced milk with the herbal teas. Then we have included low GI fruits. We have cut down on the high GI fruits in the mango, sapota, sitapal, banana. We have included all the low GI fruits like avocados, guava, apples, pears, plums and berries, oranges. All these fruits we have included either in the mid-morning or in the evening as snacks. So we have cut down on all the unhealthy drinks like the alcohol, regular soda, diet soda, and the energy drinks, soft drinks, and the sweetened fruit juices. So which doesn't have any kind of fiber. So all these minor changes we have done for a period of time. So we have included a lot of green leafy vegetables which are rich in vitamins, minerals, and antioxidants, and which are nutrient dense. In different forms we have included green leafies in the form of chutneys, smoothies, green juices, curries, and we have stuffed in rotis and included in the salads and soups. In different forms we have included green leafies. It's not just the curries that we use in traditional approach. We are including different varieties, so we are not getting bored. So healthy fats are included. So certain anti-diabetic herbs which are scientifically proven to help in controlling the sugars and reducing the insulin resistance and increasing the insulin sensitivity were included in the process, like fenugreek, cinnamon, turmeric, and tulsi, aloe vera, cloves. All these things were included in the journey. So apart from all these are the dietary changes. Apart from the dietary changes, we have made changes in the exercise routine. Post-meal walks, after lunch and dinner, we are given 10 minutes of gap and they can do normal walk of 5 to 10 minutes, which help in reducing the post-meal sugars. And there are certain exercises called anti-gravity exercises and psoriasis push-ups, which are helpful to control the sugars. We have added that. Apart from that, when they are attending the calls, they can do the walking while attending the calls and using the stairs. All these are the changes we have done to increase the physical activity rather than leading a sedentary life. So, and it used to be like late night sleep. So this is the transformation that happened because of the changes that we have discussed over a period of 6 months of time. We have started in the month of May. So by November, he lost weight, nearly 19 days of weight loss from 105 weight to 86. This is a transformation happened regarding the weight or the fat loss. There is an inch loss. I mean, there is a 4XL to he dropped down to XL. Right. So these are the reports that you can see. 32 years guy, 12.8 was the HbA1c. We were started in the month of 20th May. So after 2 months of time, that dropped down to 8.3, then 7.3. Last November, it is 6.2. Where we stopped the drugs, he is able to maintain the sugars in normal levels. So initially he was having a lot of symptoms that we discussed. He lost weight and there is a reduction of pain and the neuropathic symptoms are reduced and his sleep quality improved. There is a lack of energy levels in the initially. The energy levels and the fatigue has got energy levels improved. So fatigue has gone. All the changes have made so that he has seen this tremendous improvement in his physical health. Right. So these are the reports that you have seen in 6 months of time. Weight was 105, that dropped down to 86, and HbA1c was 12.8 as it dropped down to 6.3. Fasting sugars when we have started the journey was 282, so that dropped down to 98. Average blood glucose reduced from 321 to 134. HDL improved, LDL reduced, triglycerides reduced, and the vitamin D, which is important for both the things. For losing the weight also, there are a lot of scientific studies have shown when there is a reduction of vitamin D, when there is less vitamin D, it is tough to lose the weight and to control the sugars also. So we have corrected the vitamin D with the supplements. Vitamin B12, as most of the diabetic patients are less in vitamin B12, we have corrected with the supplements. So all these changes we have done in a period of 6 months. Right. So, a lot of people think that medicines is the only solution for type 2 diabetes. So, as per the Lancet, apart from the medication, diet and lifestyle changes will make huge difference. Yeah. So, we have used even the cesium to understand glucose levels throughout the day. So as you know, CGM will help us to track the sugar levels 24/7 and at different times how are the sugar levels and which foods are spiking the sugar levels, when he is going into low sugars. This is how we track. If you see, the average glucose levels was 252 in the beginning. So within 10 days of time, we brought the average glucose to 145. All these yellow are like spikes in the sugars, where the yellow readings, I mean above 180 is reduced. The spikes are completely reduced within like 10 days of time by using the CGM over a period of 10 days of time. Yeah, this is how we have made the changes to help achieve the reversal of remission. When we onboard the case, we understand the complete lifestyle of the patient, their diet, their lifestyle, their physical activity, their stress levels and all. So we come up with a customized plan of action and lifestyle changes and the dietary changes. That is what helping us to achieve the reversals of remissions. Like this, apart from this case, we have hundreds of cases where we are able to make difference because of the close monitoring that we do. Like this is a case of 39 years old lady with 11.8 HbA1c in the month of May. By September, we brought to 6 and we stopped the drugs in 4.5 months of time. This is a 25 years young guy with 13.7 HbA1c in the March. So by August, we brought to 4.7 where we stopped the drugs. Fine, 9.6 to 5.6 in 3.5 months, 10.8 to 5.7 in 5.5 months, 9.1 to 5.8. So all these changes, how we are able to do because of the close monitoring that we do over a period of time. So what we have observed is weight loss has significant impact on reduction of sugars. This is a case 112 to 88. So that dropped the HbA1c from 12 to 6. So 88 to 72, 16 cases of weight loss. That dropped the HbA1c from 9.5 to 5.8. So weight loss has significant impact on reduction of sugars and the reversal of remission process. So this is how we track. If you see the number 1000, 101, 500 and the 600 and the 800, this is how we track on regular basis regarding their food plates, giving the feedback and correcting the food plates. This is how we track on regular basis. We have a team of nutritionists who take care of it. That's what helps us to achieve the reversals for hundreds of cases. Yeah, this is our clinic at road number 1 Banjaris, where we focus upon reversal of remission with a scientific approach with a team of experts. Thank you for any questions and concerns.
So we'll take question and answers in the interest of time. Please note down your questions. We'll find some time towards the end of the session because the other sessions are getting delayed. Thank you, Dr. Rajendra.